Hi, this is Eric Rosenberg. In this video, I'm going to give you my top 5 Medicare supplement carrier recommendations. Now, I've done a few of these videos in the past. I usually do it right before what's called AEP, which is the annual election period. However, I'm doing a mid-year report just because I've seen a lot of dramatic things happen in the industry, and I think I want to clue the public into kind of what's going on so you guys can be well aware of it. In fact, I've seen as high as over 38% Medicare supplement rate increases. Now, that has to do with Plan F, Plan G, and even Plan N is going up in price. I'm not talking about a Medicare Advantage in this video. This is not about Medicare Advantage. This is about Medicare supplement. That's you buy additional insurance to pay the gap in coverage to Medicare. So Medicare pays 80%, and then the supplement insurance pays 20%. So you also pay the government for your Medicare. And then on top of that, you pay an additional insurance premium. That's what a Medicare supplement insurance is. You buy additional insurance so you have additional coverage. Medicare Advantage, that works differently. In that case, it doesn't go through Medicare first. Instead, everything goes through the insurance company. Now, I have different videos that explain what the difference between a Medicare supplement and a Medicare Advantage is, and you can always call. I'll leave my phone number in the comments, and so you can reach out to me should you want to talk about whether a Medicare Advantage or a Medicare supplement might be suitable for you. Now, a lot of people, they get really turned off when they hear the word Medicare Advantage. If anybody even slightly recommends a Medicare Advantage plan, they immediately turn off. However, when you have Medicare supplement premiums going up the way they are, and you're in a state where you can't switch your plans because of health questions, if you can't afford the insurance, having some insurance is better than no insurance. So I'm not saying Medicare Advantage is only good as an alternative to no insurance either. But we have to find solutions for people in all different sorts of financial situations. So also, Medicare Advantage can be a lot better depending on where you live. Florida has a much stronger Medicare Advantage market. Las Vegas does. The most you pay out of pocket for some of those plans is only like $1,000, while in Wyoming, there really isn't any real good options for you. Maybe one insurance company offers it, and the max out of pocket is much higher. So to make general broad strokes about the insurance market is just like any investment. You know, whether you want to buy CDs or you want to, and I'm not giving financial advice at this moment. I always have to give that disclaimer. But, you know, whether you're going to buy CDs or you're going to put your money in real estate or you're going to buy Bitcoin or you're going to buy stocks, everybody has their own risk tolerance. And sometimes being too conservative could be an issue because of you're losing purchasing power, so on and so forth. So it's really important to understand what is the insurance market where you live. Are there doctors nearby? How competitive is the Medicare Advantage market? How competitive are insurance companies behaving in your market? There are certain states where in Massachusetts and New York, there's only a few insurance companies that even offer Medicare supplement plans. So like in New York, the prices are much higher. Here in Florida, where I'm based, and I'm licensed all across the country. So if you have any concerns, I have my insurance license in your state, unless you're in a few states like Alaska or Hawaii and maybe Delaware. But everywhere else, I can assist you. And maybe not DC either. But other than that, if you're in that state, you can call me and I can take a look at what you have. And it doesn't matter that I'm in Florida. I could do screen shares. We could talk video, and I can look at your situation. The most important thing is you're working with someone who's competent, has been doing it a long time, has the technology to keep you up to date with your policy, because a lot of people, they don't know what's going on with their rate. They don't know what's going on with other carriers' rates. They don't know if Medicare Advantage plans are getting stronger or weaker, if Medicare supplement plans are getting stronger or weaker. So number 5, let's start with number 5, is Healthcare Service Corporation's Cigna. Okay, so the reason why they're still on my list is because they offer a lot of good discounts, especially if you're in a household. I've seen as high as 20% in a lot of states. And Healthcare Service Corporation is a parent company. What they do is they coordinate these third-party relationships. They get an underwriter, they have their portal that you would use for both agents and the consumer side, and they have to deal with customer, whether they're customer-based in the United States or they outsource some things. They're putting together all the pieces for the insurance plan. Now, all the secondary insurance plans will be accepted by any doctor that accepts Medicare, because it's just gap coverage to Medicare. What I like about Cigna is not only their household discounts, they also have been able to maintain competitive rates and be competitively stable, relatively speaking, still high, but we're talking, so in this climate, if you only went up 7.5%, that is good. Because if I'm seeing 25% all the way up to 38% increases, 7.5% is good. So I want to go to the next one. Bankers Fidelity. They're new. They're competitive. They're growing. Will they be around forever? If you're ill and you're looking for a company for the long term because you don't want to have to worry about switching in a few years, it's different for people that are healthy, because they may be tight financially and they might want to, if they know the coverage is the same, they may want to stay with one company in a few years, drop their rate $50 a month, right? And that might be their strategy, and that could be a great strategy. Other people, they want to know, they say, a lot of them just go up, so maybe I just want to be with the most reputable company that's been around for the longest. Bankers Fidelity's new. They haven't been around for the longest, but they're offering really competitive price. So you might see how everybody's different, right? You might say, I like the fact I'm saving 30, 40, $50 a month on this carrier right now. That's good, Humana. Okay. And Humana could be number 2 as well. I mean, any one of these can be one. This whole order could be, because when I go into different people's zip codes, right, the rates are all different. So it's not, again, this is just maybe an average type of thing, or a feeling of like a lot of people and the feedback I've been getting, and I want to come out with a list, because this is a great way of me giving something so people can get a general idea. But this is not specifically what is for you until you figure that out with me. So anyways, number 3 is Humana. Why I like Humana is because they do offer discounts. Okay. Now, if you're someone who doesn't live with someone and can't get a household discount, you would probably be best suited with a company not offering a household discount, or one lower. Because when that insurance company has to start raising its rates, they're going to lean on the people who are going to be most protected, who get the 12% discounts and the 20% discounts. Their rate's not going to go up nearly as high as someone who's single. So it really depends on factors like that. Most companies offer household discounts. It's kind of hard to avoid that at this point, because if you have one person that gets the policy, you want to get the spouse. Even if they're not of age yet, you might still get a roommate discount or something to that effect. Number 2 is Medico. Okay, Medico has been around not that long, but they've been behaving well as far as their rate increases as of yet. And they have their own systems. When you have your own systems, there might be more likely that you stick around than if you are piggybacking off of somebody else's systems. It kind of just shows that you're more serious about being in the supplement industry. If you have your own portal, if you have your own website for the consumer, if you have your own customer service and you're not using a different insurance company's customer service. They're also they've had a good reputation in some of these other products, some of them that I sell as well, cancer insurance. They have short-term care policies. And if you ask brokers, whenever they're talking about these ancillary products, they're always mentioning Medico as one of the ones that they're considering. So they haven't done anything to tarnish their reputation. They're owned by a company called Wellaby. So You know, I don't. They've only been around for a couple years. They haven't done anything wrong yet, but they are kind of new, and so that's one of the reasons why I don't have them in my number one spot. And my number one spot is Mutual of Omaha. Now, a lot of people are going to say, "Oh, but they close books. They have the thing for closing books. That's their reputation, closing books." That's what pretty much all the insurance companies do. Where, you know, right now, you know, Humana has one subsidiary that's offering the gym membership, another subsidiary that's not offering the gym membership. A lot of these other insurance companies are also coming out with those kinds of stylistic, even if it's not strictly what Mutual of Omaha is doing. In essence, it's stylistically the same when they have maybe competing subsidiaries and they're favoring one versus the other, or so on. So that being said, I do like Mutual of Omaha because they're a mutual company. They've been around a really long time. They invest in themselves. And this recommendation is I'm not saying that they're necessary. They do have products that are very stable in price, but like their high deductible plan. But the reason why I'm recommending them is I think we're in a very high increasing premium, not just health insurance, but auto, property, insurance prices are going up. No company is avoiding it. It's kind of like the stock market. Like if it all goes up, it all goes up. If it all goes down, it all goes down. If it's the housing market, it all goes up, it all goes up. So it's like the wave is going to catch them all. So if your goal is to continually keep your rate lower, Mutual of Omaha may not be involved in your strategy as much. But if you're looking for more of a long-term company that's not owned by stockholders, customer-based United States, I'm not saying it's 100% United States based, but what they're doing is never had anybody complain about Mutual of Omaha. I mean, people typically only really complain about the price going up, but Mutual of Omaha, it's a solid company, and they just have a good reputation for being prudent and not taking shortcuts, and allowing more functionality for billing methods and protecting consumers when they call up and let's say they didn't want to give their social security number to an agent. It's very easy to work with Mutual of Omaha in a lot of those respects. It's kind of like the tiny things that kind of add up. All the coverage is the same, but if the price equal and everything else, I usually like Mutual of Omaha. Thanks for watching. Thanks for subscribing. Thanks for giving this a like. And I will give another video. I'm probably going to come out with a few more videos before AEP. But that's if you give a like and share it and so on and so forth. If only a few hundred people watch this and I don't get any attention, not worth my time, to be honest with you. So, if you help promote this video and you found it helpful and you want me to come out with more of them, I'm only going to do it if I get a positive response. If you comment, let me know that whatever you learned. You don't even have to become my client. Just do something if you thought it was valuable, okay? That would be much appreciated. Thank you so much for watching, and I look forward to maybe hearing from you soon. Take care.